computer. Hey everyone. So tonight is our first series of fall 2025 whole family medicine conversations. Tonight we're talking about vaccine preventable diseases and like what the illness is, who is most at risk for the illness, holistic, at home, in home care tools, and emergency red flags. So we're just kind of trying to open up and bring some breathing in room into the conversation around vaccines. You know, for a long time, it's just been you either are or you are not. And I feel like it's really important for us to have more education, regardless of what we're deciding for our children, to understand why we might choose a vaccine and when is someone most at risk for getting this disease? Because sometimes things don't match up. Like many of you have been offered hepatitis B if you had a hospital birth, which we know is a sexually transmitted disease, and it's been offered to your newborn. And unless you had Hep B, which we do screenings for, there would be no reason for your child to get that vaccination. So we're going to really get into the nitty gritty and talk about why and when and how and where and what. Okay, so let's get rolling. Um, so I have a chart I will email to everyone after this call. It goes through each of the diseases and it kind of just like gives you a couple little details, and then I'll be speaking more in depth. So the first one we're going to talk about is measles, okay? So measles is a viral illness. And so just to start off, some of these are bacterial and some are viral. We use antibiotics for bacterial infections, but we can't use antibiotics for viral infections. Okay, so measles is a viral infection with a very high transmission rate. It presents with a high fever, a cough, conjunctivitis, which is just redness of the eyes. It doesn't have to be like redness and goopiness. Koplik spots, which are this rash in the mouth and a rash across the body. The people most at risk for developing complications with measles are people under the age of 1 year old, the immunocompromised, and people who are vitamin A deficient. So, how does the transmission happen? It's airborne and it can linger in the air for 2 hours. So, 90% of non immune contacts will manifest. So, that's how high the transmission rate is. So, if you don't have immunity to it and you're in a room with someone or you're somewhere 2 hours after somebody else was who had measles, you will get it. Now, how bad it is for you is what the difference is between each individual. Okay. So, in a healthy child, it's self limiting 7 to 10 days and it's over. You get the rash, you get a fever, you have a cough, and so then we can just talk about treating symptoms, right? So, the potential problems that could present, 1 in 20 will get pneumonia. Okay. 1 in 1,000 might have a seizure. And then there are some other very, very rare side effects that we could get into if you really want to know all the nitty gritty details. But, you know, we treat pneumonia with anthroposophic remedies, ideally, and supportive herbs. Worst case scenario, you take an antibiotic for the pneumonia. Or this is a viral situation. So unless the lungs were colonized with a bacteria, that we would then treat with an antibiotic, it's just a viral pneumonia, and we're doing supportive measures. Um, so our holistic support is fever, rash, light sensitivity. So one of the main treatments in measles is vitamin A. Okay, so the World Health Organization says 200,000 IU of vitamin A for 2 days, and children under the age of 12 months get a half dose of that, so they get 100,000 IU for 12 days. Okay. Um, Also, anthroposophically, we've got ferrum phosphoricum for the fever stages for the high fever, and also apis belladonna mercurius for the fever. We've got herbs like elderberry and yarrow tea to support the immune system and to support sweating a fever off, and as well as using chamomile compresses for conjunctivitis. Okay. Also, this is a situation where the children are very sensitive to the sensorium. So, quiet, being in a dark room. As long as the child isn't feverish, you can do like a lukewarm sponge bath for the itching, but we don't want to lower a fever. We always want to work with a fever. Um, And so we've got like lots of good anthroposophic creams like arnica nettle gel for itching. We've got quercus sinus internally for itching. But the main thing here is making sure that your vitamin A status is high. So like measles in a nutshell is like most kids are gonna get it if they encounter it. Now we don't really encounter it very much, but like let's say we did have an outbreak, most kids are gonna get it and they're gonna get through it fine. But we're going to want to make sure that they've got enough vitamin A. So if you're ever like, I want to prevent measles, what could you do? You could do your cod liver oil and your grass-fed beef liver capsules um, in order to like increase your dosage of vitamin A that you already have on board. They're giving these kids these super high doses of vitamin A as like a protective measure. But if you're already
Okay,
high, then
put
we
it over
know that you're
here.
going to be able to.
And
Emily,
that's
you're
fine.
unmuted and we can hear you.
Oh, I'm so sorry.
It's totally fine. It's all good. We're just hanging out here. So the vitamin A thing, like we can pre-dose with vitamin A by just giving our children good food-based sources of supplemental vitamin A. Okay. So that's measles. And we got mumps. Okay. So mumps is a salivary gland infection. So like you get kind of like little hamster cheeks or gerbil cheeks like this, right? And you're like, it hurts and there can be a headache and like pain and swelling in the jaw. Okay. But the people who are most at risk for mumps, like the biggest problem, are teens and adults. Okay. So it's pretty mild in kids. Young men, who like teenage men, can get swelling of the testicles, which is not a good thing. And pregnant women, there's a potential risk. So we do we do vaccinate small children for this in the MMR vaccine, but as you can see, this is not something that's a very big deal for young children. The transmission rate is lower than measles. The closer contact you have, the more likely transmission. The process is about 7 to 10 days in children, but obviously more complicated in adolescents. Some of the complications that children are going to encounter are these swollen saliva glands, but sucking on a lemon or a lime really helps with that. Okay. About 60 to 70% get swollen glands. 10% would get a mild aseptic meningitis. And then the teenage men get the orchitis, which is the swollen testicles. That's about 30% of post men who've gone through puberty. One in 20,000 risk hearing loss, and some females get mild pelvic pain, older females. But this also comes with a first trimester miscarriage risk. So if you were pregnant in your first trimester and you encountered mumps and you got mumps, you could potentially lose that child. Okay. So mumps, especially for our little kids, is really just about support. So in the early phase immune support, it's kind of like flu-y like symptoms. So we use the Gelsemium bryonia. For the fatigue, the Levico prunus. These are all anthroposophic remedies. The glandular swelling. We've got a nice cream. It's called Arch Angelica Eucalyptus, and it's really good for like swollen glands. It's also used for like mastitis and things like that. Warm onion compresses on the cheeks. We do those on the ears sometimes for ear infection, but we can do a warm onion compress on the cheek. And again, Apis belladonna mercurius for pain and swelling in the head is super good. Can also use vitamin C, zinc, propolis, any kind of supportive immune supplements. And you could use a calendula gargle, like a calendula tea that you gargle, and cleavers as a really awesome lymphatic mover. Really awesome early spring plant that comes out. I love to make teas out of it in the springtime, but this could be a good thing for lymphatic drainage in the situation of mumps. I just totally skipped over the red flags for measles. So I'm gonna just really quickly go back to measles. Red flags: labored breathing, persistent high fever greater than 5 days, unresponsiveness, seizures, and signs of pneumonia or ear infection. Now, you don't need to drive your kid to the ER if they have pneumonia or ear infection. With measles, you'll be talking to me. You'll be talking to me if your kid has measles. We'll be talking every day. Probably not going to happen though. Okay, back to mumps and the mumps red flags. So, severe headache, stiff neck, stiff neck, testicular pain in post-pubertal males, and difficulty swallowing or breathing. So, if these swollen glands, these salivary glands get so swollen they're like blocking the airway, we've got a problem. We want to get to the ER if that's happening. Okay. So move on to rubella. Rubella is another one that really causes problems for pregnant women. Okay. So what happens in rubella? We've got a mild rash, an illness, low grade fever, swollen lymph nodes. So the people most at risk for rubella are pregnant women, and there's something called congenital rubella syndrome. Okay, we'll talk a little bit more about that in a minute. Um, Contagion is mild. Risk of transmission is 1 week before after the rash. It's often just mistaken for a cold in most children, but it can cause severe birth defects in pregnant women in the first trimester. So, for your children, what are you going to do? Well, it looks often like a cold. So cinnabar dandelion for the runny nose and the beginning of cold, apis belladonna mercurius for the fever phase. Um, there was a suggestion for a rose petal bath for calming the rash, but we also can do oatmeal baths. We can do topical things. Um, if it's a wet rash that's weepy, we often use clay-based poultices. If it's just more itchy, we can do a lot of the arnica nettle gel, things like that. Okay. Red flags for rubella, none in children. All right. But the main deal is if you're trying to conceive and you weren't vaccinated for rubella and you didn't have rubella, um, actually, let me say that differently. If you're trying to conceive and you didn't have rubella, you should probably check immunity for rubella. And how do you do that? You pull what's called a titer. It's a blood draw, and the blood draw just indicates whether or not you have antibodies to rubella. And from childhood, from your MMR vaccines, maybe they're still there, maybe they're not, but you want to make sure that you have immunity um, to rubella if you're pregnant, or you want to be very aware of the fact that you don't have immunity if there is an outbreak of rubella or if you're around anyone with rubella. Okay, just to put it simply. Okay, let's talk about chickenpox now. Okay, so for some of us, we had chickenpox and there was no vaccine, and you just dealt with it, and that was my reality. Many people now still get chickenpox. Chickenpox has been a reason that schools have kept kids at home. So if there's like a chickenpox outbreak, which there have been in Asheville, they will say to your child, "You're welcome to come back to school if you get vaccinated, or you can stay home until the last child in the school had chickenpox and it's been 3 weeks." So your kid has to stay home for 3 weeks. It's like a quarantine because they're not vaccinated. Okay. But chickenpox itself is not such a big deal. And we're going to talk about that right now. So there's a fever, it's itchy, there's a blistering rash. So a lot of times it starts with just like an upper respiratory syndrome, like runny nose, just regular cold stuff. Sometimes that's even missed. And then you just start getting these little fluid filled blisters that pop and then crust. And so when the last blister has popped and crusted, um, you are no longer contagious with chickenpox. The most at risk people, immunocompromised, that's always going to be the case. Infants less than 1 year, teens and adults because the rash is more severe, and people who have eczema and a lot of skin breakdown. So the less strong the integrity of your skin is, because this is a full body rash, the more of a problem it is. And so in an eczema situation, you might find that. So it's highly contagious via droplet and contact. So touching and sneezing, speaking, singing. In healthy children, 7 to 10 days from fever to rash. Contagious for 2 days before the lesions and until all the lesions are scabbed. So you're contagious before your first chickenpox even comes out, and that's how these things get passed on. The risk of impetigo from scratching. There's a risk of pneumonia in adults and an encephalitis in rare cases, like 1 in 1,000, 1 in 10,000. Um, it causes, and the virus can reactivate as shingles later in life, but the more times you encounter chickenpox, the less likely you are to get shingles. Like if you worked in like childcare your whole life and you were around a lot of kids who had chickenpox, you might actually decrease your risk of shingles. So what do? We take these baths, these oatmeal baths, baking soda, bentonite clay. You can do calendula salves, clay salves. I highly recommend taking lemon balm every 4 hours, tincture, 4 hours while awake through the whole thing. It's an antiviral and it just decreases the intensity of it. Licorice root is also an antiviral. Oat straw is nice and calming to the system. Anthroposophic remedies. The I'm trying to think of the name of it. I've got a different name in front of me. It's the Quercus sinus from Uriel. Calms itching on the inside. And then we've got the arnica nettle gel for the outside. Vitamin C, zinc, lysine supplements can all be helpful. Vitamin C is usually talked about till bowel tolerance, so you take it until your bowels get loose, and then you know that that's the right dosage. Although we can talk about children's dosage of vitamin C. Um, the main thing is with adults, it's just like the older you are, the worse it gets. My son got it at like 15, and it was full body, and he dealt with it okay, but it was just full body head to toe, all the parts. So not fun. Um, okay, red flags for chickenpox. Rashes involving the eyes or just rapidly spreading. Okay. Um, Signs of infection like redness, pus, and pain. That's where we're thinking like, we're scratching, we're getting bacteria from our nails in the wound. We don't want to create infections inside of these little pustules. So that's where impetigo gets mentioned. We use mupirocin ointment for that and usually an internal Oregon grapefruit just to make sure the bacteria is clearing the system. Um, Lethargy or confusion, and trouble breathing or chest pain are all red flags. So, any of these red flags, if we were working together with your child through one of these vaccine preventable diseases, if we hit the red flags, then I need a phone call or you're going to the ER. And like I said, if any of you encounter any of these things, we should be working closely together, communicating um, at least every couple days to just check in and see how they're doing. All right, next one, pertussis or whooping cough. This came through Asheville last year. I saw some cases show up before the flood, and I stocked up on my Cuprum aceticum and my Droseracomp from Uriel, and we took many, many children through whooping cough successfully. It starts out like a cold, just like a normal cold. And by the way, I have a whole like 18-minute video on the YouTube channel that I'm in the process of transitioning to the Whole Family Medicine YouTube channel, all on pertussis. So there's spiritual aspects of pertussis, and you can hear all about that, ways that pertussis actually helps children's growth and development. And all of these vaccine preventable diseases actually really do because they are challenges to the immune system. And whenever we have a challenge to the immune system, there's an opportunity for like greater contact with ourself, becoming more embodied, becoming less anxious, more just at ease with ourselves. And so a lot of these vaccine preventable diseases, the few that we're allowed to get, like chickenpox and whooping cough, can be welcome because they do actually allow the children's proper spiritual development and physical development. But anyway, I digress. Whooping cough starts like a cold, progresses to a violent coughing fit with possible vomiting or apnea. So what happens is it's a hacking cough. You cough and cough and cough and cough and cough, and you have a hard time catching a breath. So there's this big like a whoop. That's like the whoop sound. And then in small people with small airways, we worry about them not being able to catch that breath. So children who is most at risk, infants less than 6 months old, children with lung and heart conflicts. So if a child is compromised in their lung and heart, this is a place where we might choose to use an antibiotic rather than going with the anthroposophic support. It's most contagious prior to the coughing fit. So during that little like light cold thing that they're having that looks like everything else, that's when they're most contagious. And that's how it's really easy to pass whooping cough along. Usually you're like, oh, I'm going to call everybody. It was my birthday party 2 weeks ago because I now have whooping cough and they might too. So you call everyone, you let them know. So how is it diagnosed? We've got these swabs, send them into LabCorp. We can diagnose you. Um, the Western treatment is actually using an antibiotic as a prevention if you were even around it, and then using it for treatment. If you start the antibiotic after 3 weeks, it doesn't really have very much merit. And we have been able to successfully get through whooping cough in our family and lots of your families without antibiotics at all. But I will do either, whichever you prefer. So What do we do? We've got the specific Uriel whooping cough formula, the Drosera comp and the Cupramicida come in. You're like every hour you're doing one or the other, especially leading up to bedtime because whooping cough is worse at night. We do the plantain beeswax rub on the chest and the back, really nice cough rub. Um, we use lung root cough syrup from True Botanica. That is the best cough syrup. You're going to hear more about it in my winter wellness conversation in a couple of weeks. Use the lung root cough syrup every 4 hours. We have the pertussis nosode, which is the homeopathic remedy made of pertussis. And I just give that out for free. I just keep it in the office, give you a little baggie. Everybody in the family takes some, take it like once a week. It's a 30C. Everybody takes that. And then I also like to do Oregon grapefruit or some kind of herb with an antibacterial antibiotic, either like biocidin if you have any laying around, or golden seal, Oregon grapefruit, yellow root, something that's got berberine in it that's going to kill the bacteria because this is a bacteria. So all those things together, we've managed whooping cough well. And you'll notice sometimes in families, like some of the kids will get it and some won't. So it really is a specific opportunity for some children to develop themselves a little bit more fully. Other tools, steam, propped up sleeping, small frequent feedings. I guess that's so they don't vomit too much when they're coughing. You can do vitamin C supplementation. It says cod liver oil, but that just feels to me like we should just all be doing that to develop our vitamin A and vitamin D through the winter. Red flags, bluish lips, apnea, gasping or difficulty breathing, vomiting after a cough. Now, vomiting after a cough just means that you have whooping cough. But if you're like aspirating it, if you're choking on it, if you're not breathing, these are reasons to go to the ER. Okay. And definitely we would be very cautious with a child under the age of 6 months. Okay. So the next one is tetanus. And this is a really tricky one. This is the one where like we probably want to have a phone call because a lot of people don't want to just go get tetanus, diphtheria, and whooping cough vaccine just because they stepped on something rusty and it was metal and it cut their foot. So this is a very nuanced thing, and we would probably need to talk about this, about your specific situation. Obviously, tetanus is not contagious. It is from deep puncture wounds that might seed the bacteria. The bad thing is it leads to muscle stiffness, muscle spasms, and stiffness. Most at risk are deep wounds exposed to soil, manure, and rust. Also, birth injuries in non sterile settings. The amount of bleeding and flushing that occurs at the moment of injury really depends the risk. So, if you like slice your hand open and you can like see everything and it bleeds a lot and you can like clean it with a lot of water and you can like really rinse it really good when it happens, if you get cut by a piece of metal, rusty metal, that's probably not going to be a tetanus situation. Now, if you go to the ER, they are going to treat you like you have tetanus and they're going to say, do you have the most recent, are you up to date on your vaccinations? And if you're not, depending on the situation, they're either going to give you immunity to tetanus, like here you go. It's called an immunoglobulin. It's an injection of like immediate immunity to tetanus, or they're going to give you the vaccine and hope that your body like makes the immunity to the vaccine in enough time before tetanus sets in. But my understanding is they give out the immunoglobulin in the hospital. Okay, so what you're trying to prevent is tetany, which is like all the muscles in the body lock up. Okay, there are 30 cases per year, mostly in adults without boosters. Okay, so it's not very common. Um, if you are vaccinated, if your vaccination status is uncertain and you feel like you've been exposed to tetanus, um, serious cleaning and follow up with hydrogen peroxide, golden seal, yarrow, calendula, honey packing in the wounds, keeping the wound open when possible, like not letting it shut, like not letting the flap of skin cover it. You can do internal organ grapefruit and echinacea. Um, red flags, jaw stiffness that can set in through 3 to 21 days after exposure would be the first sign. So this could be going on, and 21 days later, you get jaw stiffness, back arching and spasms, and trouble swallowing. If you get tetanus and you don't take care of it and you don't go to the hospital, and then you realize that you have it and you go to the hospital, there are things that can be done. It's not like oh my gosh, you are done for, but it's serious. It's like an inpatient stay and it's a lot of IV medicines, and most function is restored, but maybe not all. So, this is a bigger conversation. This is probably the one vaccine that people consider getting their children when they start getting busy and crawling around and getting more active. But the unfortunate thing is that you cannot get it separate from um, the whooping cough, the pertussis, and the diphtheria. It is There might be some clinics or some way to order a specific bundle of just tetanus, but it's not you're not going to get it from like the hospital or um, the health department or something like that. Okay. All right. Sorry about the yawning. um, we've got diphtheria now. Okay, part 3 of the Tdap. This is a very rare but very severe respiratory illness. Okay. It is not, it is like overseas. It like hasn't been here for a long time. But gray membranes on the tonsils, sore throat, and fever. Um, my understanding is that if you get this, you should be in the hospital. You're not talking to me. We are going. Um, so most at risk, unvaccinated in an outbreak setting and overseas. There has been less than one case a year in the past 55 years in the United States, and it can be life-threatening without hospitalization. There's a 1% fatality rate with care. So in the hospital, 99% of people do super well and survive. So we are probably not going to encounter it here, but if you do, we need to go to the hospital. Um, it's an antitoxin and antibiotics that are required. And of course, if you have a throat infection, we could do gargles and things like that, but it's almost not even worth discussing like what the at-home care for diphtheria would be because it's you're not going to be at home. Red flags in diphtheria would be difficulty breathing or swallowing, gray-white throat coating, and weakness and cardiac signs. Okay, moving on to polio. So this is really interesting. I didn't really realize this before I prepared this talk, is that lots of people got polio and very, very, very few people got bad results from polio. So I think there's like this story of like the summer in the 1950s or 60s and all these kids are getting sick and nobody knows what's going on. Parents aren't letting children play in the neighborhood. Um, but so what happens? So mostly asymptomatic, rare neurological complications leading to paralysis. This is not common in the United States, but it is higher when traveling. Okay, so this is a fecal oral route transmission. There is no wild polio cases in the US since 1979, but there are vaccine caused diseases in other countries because we don't use a live polio vaccine anymore, but they do. I think it's cheaper. So you're not going to like get polio from someone who got a polio vaccine in the United States, but you could get polio from someone who got a polio vaccine in India or somewhere else. Okay. So this is global data. Okay. Global data. So like all over the world, these are the percents. 72% of people who are exposed to polio have no symptoms. That's what surprised me. 24% have fever, nausea, sore throat, and fatigue. Okay. Sounds like a really bad week. 1 to 4% have stiff neck and back pain and recover in days. And less than 0.5% are flaccid paralysis. And of those 0.5%, 2 to 5% of those people die. So I have this image of like polio and like everyone's in these iron lungs and that's the machine. That was like the old school ventilators. And like we've got like all these people are so sick and all these things are happening. Well, it doesn't really sound like that. So I'm just going to repeat myself. In the whole world, 72% of people who are exposed to polio have no symptoms. 24% have a bad week, fever, nausea, sore throat, and fatigue. 1 to 4% get stiff neck and back pain and recover in days. And less than 0.5% have flaccid paralysis. And of that 0.5%, 2 to 5% die. So, holistic support. If you got it, prevention would be good gut health, hygiene, antiviral support like lemon balm and licorice. So, like if you're traveling in a polio known risk environment, you could just make sure that you have really good gut health. Um, Neurological rehab is for after the illness care. What are some red flags? Sudden weakness in the limbs, trouble walking, flaccid limbs, and difficulty breathing. Okay. Now, the next one is the HIB. It's the Haemophilus influenza type B vaccine. Now we're getting into vaccines that you don't even give kids after age 5. Okay. So this can cause epiglottitis, which is inflammation of the epiglottis, airway obstruction, pneumonia, okay, infection in the lungs, and congestion in the lungs, meningitis, spinal inflammation, or sepsis and joint infection. So it's a gram-negative bacteria spread by droplets in close contact. Most at risk under age 5, especially under age 2. We don't actually vaccinate kids over age 5 for this. Prior to the vaccine in the 1980s, there were 20,000 severe cases every year. That's pretty significant. Now there's less than 50. This is one of those times when you go, I'm banking on herd immunity here. Like I know that in the recent past, this was a thing, and kids did get very sick and die. Um, but now we've eradicated it because most people are vaccinated. Most cases now occur in unvaccinated children and immunosuppressed children because they can't get vaccinated or prior to 6 months of age. It does require IV antibiotics and a hospital stay if you get it. Um, Holistic support, prevention, um, breast breastfeeding, minimizing daycare exposure in infancy. So this is the thing. It's like being in the daycare with so many kids in such close contact with so many little guys. Like this was spreading. So if you were staying at home with your kid and you were breastfeeding, even when this vaccine first came out, it probably wasn't necessary for you if your child was limited to lots of contact with lots of small children. Um, if someone does get sick, antiviral and immune support, apis belladonna, mercurius for fever. What are the red flags? So epiglottitis looks like you're leaning forward, you're drooling, you're in the tripod position when you're leaning forward. You're like, tripod is like when you're like standing there and you're like leaning forward and your like hands are on your knees. That's like the easiest way to get air in and out. So that indicates if you ever see someone doing that they're short of breath. High fever, I did it again, stiff neck, um, indicating meningitis and lethargy or seizures. Okay. So that is the HIB. And then we've got the pneumococcal vaccine. This is actually like a pneumonia vaccine. They give this vaccine to old people too, to the elderly. It's a kid's vaccine, but then they started giving 2 different pneumonia vaccines to people over the age of 65. It can cause ear infections. It can cause pneumonia. It can cause sinus infections, meningitis, and sepsis. So it just depends on where it lands in your system if you get it. People who are most at risk are infants, elderly, immune suppressed, and children in daycare. It's transmitted by respiratory droplet and can live in the nares without symptoms. And this is true for 20 to 50% of children. So some of them are just running around with it. Um, Obviously, wherever it lands is going to determine what we do about it. So if we get an ear infection, we're going to use the onion ear compress, the apis belladonna mercurius. We're going to do ear oil drops if we need to. We can do aspirea for pain, sinusitis. Um, Usually we can do the Beyond Peon. We can do the Echinacea thuya from Uriel. A lot of times these things will just clear up on their own. Lots of steaming, lots of nose blowing, cinnabar dandelion, and citrus urtica comp. If you get pneumonia, it can range from life-threatening to mild, especially in infants, elderly, or the immunocompromised. Obviously, we'll be treating the pneumonia as well with antiprosophic remedies and antibiotics in this case if needed. Sepsis, very rare in healthy children in the United States, and meningitis, rare, but can cause death or long-term damage, hearing loss, or seizures. Okay, so again, um, happy, healthy children who are not in super close contact with a bunch of other children who are being breastfed and we're able to catch these things early should have no problem. Okay. Serious sequela is rare in breastfed children, not in childcare. Anthroposophic and other support depend on the symptoms. We already kind of talked about that. Other supplements just for immunity, vitamin cod liver oil, where you get your vitamin D and your vitamin A, zinc, and acetylcysteine as well for the liver detoxification. And herbs for the lungs would be the mullein and the elecampane, among many, many others for the pneumonia. Red flags: labored breathing, chest pain, high fever, unresponsive, severe ear pain, and pus. Um, One last major vaccine we're going to talk about here, and then we're going to mention the ones we didn't talk about and why. And this also, rotavirus is one of those ones. They used to have like a rotavirus and a norovirus vaccine, and they've come on and off the vaccine schedule. Um, Rotavirus is diarrhea, vomiting, and fever. There's a risk of dehydration. Most at risk are children under the age of 2 years old. This is a winter and springtime thing. What do you do? We do oral rehydration, Kangen water, coconut water, homemade oral rehydration solutions like a little bit of apple juice, a little bit of lime, a little bit of salt. You can use Pedialyte, but it's kind of gross. Um, Herbs like blackberry leaf um, tonify the bowels, as does things like coptis and Oregon grapefruit, and golden seal. Chamomile and ginger are gentle on the belly. You know, my favorite for diarrhea and vomiting is carbochamomile from Uriel. The best thing ever, works really well. Supplements, probiotic. Saccharomyces boulardii is a special kind of probiotic that stops diarrhea. And zinc. And red flags would just be signs and symptoms of dehydration. So, no urination for 18 hours, dry mouth. If the baby still has an open fontanelle, soft spot right here, it would be sunken. Crying with no tears, rapid breathing, and listlessness. So, those are the 11 vaccines that are on the early childhood schedule, with the exception of hepatitis B. And I will briefly touch on that. So, hepatitis B is a sexually transmitted disease. It is a blood-borne disease, and it can also be transmitted through shared needles or accidental needle sticks. So, this is a vaccine that I got in middle school because that's when it was created. That felt a little more appropriate. In the nursing field, you have to stay current with your hepatitis B because if you get an accidental needle stick, they want that to be covered. But for the most part, this is the first vaccine they want to give you at birth. And the reason they want to, and I mentioned this earlier, the reason they want to give it to you at birth is like if mother is Hep B positive and she doesn't know it and she passes it to the baby, then they already have hepatitis B. But we test for these things. And, so it's like we have to think about, if this is necessary or not. I always say that vaccines are about treating the lowest common denominator, like the most economically, like disadvantaged person, living in a major city with no access to good food or clean air. They're in a food desert. There's a bunch of emotional stress in the household, and the cognitive decision making process of the parents is not very developed. That's who, those people need vaccines, right? Not every single person needs a vaccine. We have to think about what the vaccine is and what is it doing, and is it for me or not. And so this is what this conversation has been about. Okay, there is the meningococcal vaccine. That is one that they give to children who are going to college. This is like the college one. And then there's the HPV, which is the cervical cancer vaccine. I haven't done a lot of research on it. I certainly wouldn't want it. I wouldn't give it to my girls. I haven't heard a lot of really wonderful things about it. I think that we can screen for cervical cancer and we can take care of our bodies and treat ourselves if there is a cervical cancer threat. Okay. Also, obviously, COVID-19 was a vaccine that was on the schedule as well, and we've seen all the negative side effects of that one. So that's what I've got. And I'm really curious what kind of conversations people have or questions people have, what kind of conversations people want to have. Feel free to jump on camera and we could talk and um, share, any concerns. I really did this because a lot of people were coming and going, pretty sure I'm not vaccinating my kids, but it's like I want to have more information. I want to have a better understanding for why I'm doing what I'm doing and to know if it's important if my kid does have a vaccine or not. I will say that in the state of North Carolina, to go to school, there is a religious exemption, but you can't pick and choose your vaccines if you are religiously opposed to vaccination. So if you're philosophically opposed, you could pick and choose your vaccines, but there is not that exemption in the state of North Carolina. So partial vaccination is not a great idea. But we can talk about all those things too. Anybody have any questions? Anyone want to get on camera and say hi?
On camera. Hi. Can you just go over, so you said Hep B, hepatitis B was one that is like not basically if you don't get vaccinated before age 5, then it's not required. Can you go, is that true? And if so, can you go over if
Yeah,
there's any more that
yeah,
are like
that's the
like
HIB. So there's hepatitis B, and then there's HIB, which is Haemophilus influenza. So the HIB, the Haemophilus, it's HIB, Haemophilus
yeah.
influenza type B. They do not vaccinate after age 5. They do not vaccinate after age 5 for rotavirus or the pneumonia vaccine. Those are the three that I know of that they
Okay.
do not vaccinate. Like if you were to just like come out of the woodwork and go to a regular pediatrician and say, "Here I am, and I'm 7," there's a couple they wouldn't vaccinate you for, and they'd use what's called a catch-up schedule, and they'd get you all caught up on your MMR and your polio and your hepatitis B and all those. Yeah,
Okay.
yeah. Hi, baby. Anybody else wants to jump on and ask a question? I mean, this is very nuanced, and I'm happy to talk nuance here too if you want to ask more questions about any of them. All right. Well, I know it's that dinner time, so everyone's probably in the middle of putting their kids to bed and they don't want to jump on camera. But there's Christine and Philip. Awesome. Um, I will. Hi, Susan. Good to see you. Do you have any questions, Susan?
Well, now that you're asking me directly, I do
Directly.
have one. So you mentioned, and the reason why I ask is because last year, I had the norovirus like wicked.
Yeah.
And so, you mentioned there was one, homeopathic remedy that you used, but what does it actually do? Like,
Oh,
I
yeah.
mean, I'm not expecting it to like make me stop throwing up, but like, what is it doing in the body
Okay, yeah,
necessarily?
I can totally speak to that. So the carbocamellia from Uriel has like 15 different homeopathics in it, and it really does work well to settle the stomach. It's like
Okay.
anti-cramping, anti-diarrhea, anti-nausea. Um, I mean, and that remedy is really cool because you can use it for acute situations, but I've also used it for people who are diagnosed with Crohn's before too.
Okay, because Louisa didn't get it back. I mean, I think she just had diarrhea. I mean, she
Yeah,
wasn't vomiting,
yeah.
but when she gets older, she might. Yeah.
My favorite thing to do for vomiting is to get lemon balm. Lemon balm, one of my acupuncturists was like, lemon balm will stop you from throwing up. I've had one of those situations where I'm like throwing up and throwing up, throwing up, and the lemon balm will stop it. You still are sick or whatever, but you either get like a tincture and you water it down, you like slowly sip. It's like one of those illnesses where you drink the cup of water and you can't even hold down the cup of water.
Yeah.
The lemon balm, if you slowly sip, or you can make a tea of it. If it's a winter time, you got to use the tincture. If you've got fresh plant, the lemon balm does work really good for vomiting that just doesn't want to stop. Yep.
That's the only thing that stuck out to me when
Yeah,
you said
thank
that. I kind of
you.
chuckled because I had flashbacks.
Oh my gosh. Yeah, and that's the one, that's the norovirus. That's the one that's like come on and off the schedule a couple
Yeah.
of times, and
Yeah.
they kept the rotavirus. So well, it's almost 7. Does anybody else have any questions? This is going to be available. You can share it with your friends and family. And there's more details to each of these diseases. So if any of them stuck out and you're like, oh man, I really want to understand this one a little bit more. I feel uncomfortable about this one for this specific reason for my family. We can certainly talk about that. And I will also, when I email the link for the video, I will also send the notes. It's like a table. This right here. It's just kind of like it goes through with like the disease and all the information about it. So that'll be shared with you. It's like the disease, what is it? How common is it today? Severity in healthy kids, serious complications, vaccine type and effectiveness, notable side effects. Consider for who would you consider the vaccine for, and what does natural immunity give you? So that'll be a nice little a little thing to keep and have on hand. I think it's good to remind ourselves why we've made the decisions that we've made, and sometimes revisiting this material can just be helpful to keep us steady and on course with the decisions we've made. All right, everyone, thank you so much for being here. Have a wonderful evening. We're doing another one 6 o'clock 2 weeks from now. I can't remember if we're going to winter wellness at that point or um, I don't know. Anyway, but it's on the schedule. So we'll talk later. Everyone have a great night. Take care.
Thank you. Good night.
Later.
Night, y'all.